93,000. That's the number of deaths in 2020 from opioid overdoses. That's 23,000 more deaths than the previous year. And we were in the middle of a global pandemic when the world was essentially on lockdown. I think we can all agree that we're in the middle of a global opioid crisis or epidemic. My question to you is, why is this happening? Perhaps we need to change our perspective. Perhaps we need to challenge our assumptions. What happens when we see a patient experiencing pain? We give them pills or injections or surgery. What about sleep disturbances? We give them pills and more pills. What about depression, anxiety, or PTSD? We give them pills, maybe therapy. Or worse yet, sometimes we don't do anything at all. But what if these aren't the actual problems that we are treating? What if these are symptoms of something larger and a more difficult problem to treat? Perhaps we're all missing the forest because of all the trees. So here's a provocative thought. These things, sleep disturbances, pain, depression, anxiety, and PTSD, they're symptoms of trauma. Workplace trauma. Every claim that we handle is the result of a traumatic event. And trauma has two distinct components. The first is physical trauma. Physical trauma is easy to see. Physical trauma presents itself as a broken bone, a crush, or a burn. Physical trauma is easy to see and it's easy to treat. But the second component is emotional trauma. And emotional trauma is impossible to see. And it's even more difficult to address. Emotional trauma presents itself in very insidious ways. A patient sitting quietly asking, "Can I pay my bills? Will I be able to make my mortgage?" The social isolation of losing your workplace social construct. A patient asking themselves, "How am I going to support my family?" Some even have a loss of their personal identity at their injury. I don't know about you, but part of how I identify myself to the world is as a physician. Imagine having that taken away from you. The thing with trauma is that if we want to effectively treat it, we have to treat both. With that, please let me introduce myself. My name is Dr. Jerry Stanley, and I'm a third-generation family physician. I also have the privilege to serve as the Chief Medical Officer for Harvard MedTech, a digital health company that couples virtual reality with behavioral health therapy interventions, something that is referred to as VX therapy. We use virtual reality to engage patients dealing with workplace trauma, and we couple that with specific behavioral health interventions using a biopsychosocial construct with the goal of getting the patient back to normal. You see, just as patients experience trauma in very unique ways, patients have a very unique sense of what makes them feel normal. So it's imperative for us that we strive to get the patient back to normal. If somebody likes to garden, or perhaps they like to fish, we want to get that patient back to their version of normal, because I think we can all agree that it's normal to go back to work. Now, many of you may hear the words biopsychosocial and think that these are words batted around at a cocktail party by a bunch of out-of-touch senior executives. But let me assure you today that this philosophy is not a platitude. You cannot address workplace trauma without effectively addressing all three components. Biologic. What is the nature of their injury, and how can we heal that inherent physiology? Psychologic. How does this trauma impact how the patient sees and feels about themselves? And how can this event reactivate historical traumas in their life? And socially, how does this impact how the patient interacts with the world around them? And how are the effects of their social upbringing or potential adverse childhood events going to be reactivated and delay healing and recovery from this event? You cannot address the whole without acknowledging the individual components. So with that, let's go back to changing our perspective. Let's go back to challenging our assumptions.